Influenza, commonly referred to as the flu, is a contagious respiratory illness caused by influenza viruses. It affects the nose, throat, and lungs and can lead to mild to severe illness. In certain cases, it can be fatal, especially in vulnerable populations such as the elderly, young children, and individuals with weakened immune systems. Unlike the common cold, the flu typically comes on suddenly and is associated with more intense symptoms. Causes and types. Influenza is caused by influenza viruses that are categorized into four main types: A, B, C, and D. Influenza A, this is the most common and typically the most severe form. It is responsible for most seasonal flu epidemics and has the potential to cause pandemics. Influenza A viruses are further divided into subtypes based on two proteins on the virus surface, hemagglutinin, H, and neuraminidase, N, such as H1N1 or H3N2. Influenza B, these viruses also contribute to seasonal outbreaks but are generally less severe than type A. They are not categorized into subtypes and only infect humans. Influenza C, this type causes mild respiratory illness and does not cause epidemics. Influenza D, this type primarily affects cattle and is not known to infect or cause illness in humans. Transmission. Influenza spreads mainly through respiratory droplets when an infected person coughs, sneezes, or talks. It can also spread by touching surfaces or objects contaminated with the virus and then touching the mouth, nose, or eyes. The flu is highly contagious, and individuals are most infectious in the first 3 to 4 days after illness begins, although they may spread the virus even before symptoms appear and up to a week or more afterward. Symptoms. Symptoms of influenza usually develop quickly and can vary in severity. Common symptoms include high fever and chills, cough, usually dry, sore throat, runny or stuffy nose, muscle or body aches, headache, fatigue, tiredness. Some individuals, especially children, may also experience vomiting and diarrhea. It is important to note that not everyone with the flu will have a fever, which can make diagnosis more difficult. Complications. While most people recover from the flu within a few days to less than 2 weeks, some may develop complications such as pneumonia, bronchitis, sinus and ear infections, worsening of chronic medical conditions like asthma, heart disease, or diabetes. In severe cases, influenza can lead to hospitalization and death, particularly among older adults, young children, pregnant women, and people with underlying health issues. Diagnosis. Flu is often diagnosed based on symptoms and clinical evaluation. In some cases, especially in hospitals or for at-risk patients, doctors may use laboratory tests like rapid influenza diagnostic tests, RIDTs, or molecular assays to confirm the presence of the virus. Treatment. Most people with influenza recover without needing medical treatment. However, several antiviral drugs are available that can reduce the severity and duration of the illness if taken early, within 48 hours of symptom onset. Common antiviral medications include oseltamivir, Tamiflu, zanamivir, Relenza, peramivir, Rapivab, baloxavir marboxil, Cofloza. Antibiotics are ineffective against the flu since it is a viral infection, though they may be prescribed if secondary bacterial infections occur. Prevention. The best way to prevent influenza is through annual vaccination. Because the flu virus mutates frequently, flu vaccines are reformulated each year to match the circulating strains. Vaccines are recommended for everyone aged 6 months and older, especially high-risk groups. Additional preventive measures include frequent hand washing with soap and water, avoiding close contact with sick individuals, covering the mouth and nose when coughing or sneezing, staying home when sick, disinfecting surfaces regularly. Influenza vs. common cold. Although the flu and the common cold are both respiratory illnesses, They are caused by different viruses and differ in severity. The flu tends to be more intense and sudden in onset, with a higher likelihood of fever, body aches, and fatigue. Seasonal and pandemic influenza. Seasonal flu occurs annually, typically during the fall and winter. In contrast, pandemic flu occurs when a new influenza A virus emerges and spreads globally, causing widespread illness due to lack of population immunity. Notable flu pandemics include the 1918 Spanish flu, H1N1, the 1957 Asian flu, H2N2, the 1968 Hong Kong flu, H3N2, and the 2009 swine flu, H1N1. Conclusion. Influenza is a serious and potentially life-threatening illness that affects millions worldwide each year. While most people recover quickly, the flu can have severe consequences for at-risk populations. Timely vaccination, good hygiene practices, and prompt medical care are essential for managing and preventing influenza. Public awareness and global cooperation remain vital in controlling outbreaks and preventing future pandemics.
Thank you for watching. Please subscribe our channel.